Imagine your eyes getting bigger and bigger, one of them just bulging out and looking abnormal. It may sound very foreign, as if I'm speaking about a sci-fi movie, but this actually happens to some patients. This condition is what we call proptosis, and it is a very, very serious condition. And so today we'll be discussing, what is it, how does it come about, and who actually gets it, and is there actually a treatment for this? So this is the DrTebz show, where we're putting your health back into your hands. To discuss this very interesting topic, I have Dr. Hamza Mustak. He is a qualified ophthalmologist who's heading up the ocular plastics and orbital unit, as well as the ocular oncology unit at Groote Hospital in Cape Town. And he also has his own private practice at the Atlantic Eye Center in Cape Town. So it is an honor to have this man who has such vast knowledge and experience in treating the sign that people actually experience. Hi Hamza, thank you so much for joining me today.
Pleasure, thank you for having me.
So Hamza, can you give us a good outline just to describe what is the socket, what is the orbit, because this is where proptosis actually occurs.
Sure. So the orbit essentially refers to the bony protective casing around the eye and the contents that support the eye. So if you feel around the eyeball, you will see that it's surrounded by this bony structure with an opening into which the eye sits. So the muscles that attach onto the eye that allow for eye movement, there's cushioning fat behind the eye, as well as various nerves and blood vessels that course through that path. And the orbit actually communicates to the base of the skull and eventually through a little canal where the optic nerve runs into the brain. So when we talk about the orbit, we refer to all of the structures within that bony sort of compartment. And if we look at the anatomy, it's actually shaped like a cone would be shaped. So a wider opening at the outside, which then narrows as it goes further back towards the what we call the apex of the orbit.
Okay, so can you describe can you explain what is proptosis? And then can you tell us what are some of the causes in adults and in children?
Yeah. So what is proptosis? So proptosis refers to the forward pushing of the eyeball. Okay. So if we look at the orbit, the eye has a certain sort of relationship in terms of its position within the orbit. So the orbit is occupied by the volume that comprises the eyeball, its muscles, the nerves, and the fat that protects and surrounds it. And so if there's an increase in the volume of the orbit, and this could be due to tumors or growths behind the eyeball, or it could be to certain conditions which lead to a growth in the muscles and the fat of the eyeball, you can imagine that there's no more space because it's surrounded by a bony wall, which is not unforgiving in terms of making space. And so there's only one natural way to expand, and that's forward. And so any sort of increase in the volume behind the eye is going to then result in the eye pushing forward gradually, and that pushing forward of the eye is what we call proptosis.
Okay, so now that you've explained what is proptosis, so in adults and in children, what are the diagnoses, the common conditions that cause proptosis in these groups of people?
Sure. So, I mean, there could be many different causes for proptosis. So essentially the way I sort of look at it is are we looking at a different growth or mass, or it would be a tumor, which can either be benign or malignant or cancerous, that's growing and expanding the space there, or is it a condition which is resulting in swelling of the fat and the muscles, which is what we call an inflammatory condition. So if we look at adults, by far the most common cause of proptosis is thyroid associated orbitopathy, as the terminology we use, or Graves' disease, so Graves' orbitopathy. So these are patients who've got autoimmune thyroid disease, and the mechanism of how it occurs is that your body mistakes the thyroid gland as a foreign.
Wait, what is the thyroid gland? People don't know what the thyroid gland is.
So the thyroid gland is it's a little gland that's situated here just in the front of your neck. and it produces hormones that are very important in the regulation of your sort of body cycles.
Yes.
And so these are what we call metabolic hormonal pathways. So the thyroid is very important in regulating, your metabolism. So, and so patients who have got hyperthyroidism, so they're producing too much thyroid hormone, will present with symptoms that are suggestive of hyperactive metabolism. So weight loss, which is unexplained, increased appetite, intolerance of heat. They may get palpitations as though they've had too much coffee, tremors, shakes, These are things that sort of signify an increased metabolic state. Okay. And then if you've got hypothyroidism, so you're producing too little, it will be the opposite of that. So you present with fatigue, lethargy, weight gain that's unexplained, depressed mood, insomnia, and lack of sleep, etc.
Okay, so that's the one cause in adults.
Yes.
And then what are some of the other causes in adults because you said that's the first one?
Yeah. So that's probably the most common one that we would see. Then other causes, so we can look at other inflammatory causes. So sometimes we see inflammation within the orbit for which we don't have an obvious cause. We can't identify an obvious cause. So we call that idiopathic, meaning we don't know, orbital inflammation. So, and it can present with, so like inflammation anywhere else. So example, if you bump your leg or your knee, you will see your leg will swell up, it will go red, and so those are signs of inflammation. So this can occur within the orbit, and if that happens, then the fat and the muscles can swell up, and if they swell up, then the space is, as we said, limited, and so the only sort of space available is forward, and so that can then also cause proptosis. And then lastly is obviously we need to exclude that there isn't a growth behind the eye. And this growth can arise primarily from orbital structures. So these can be tumors of the nerves that run there, of blood vessels that run there, tumors of the muscle, as well as the tear gland that's inside the orbit. Exactly. And then obviously if it's a tumor that's spread from elsewhere is the other thing we need to consider.
So proptosis shouldn't be taken lightly. But also some kids also get proptosis, where the eye is bulging and the parent can't understand, why is my child's eye all of a sudden looking bigger as compared to, because that's how they say it.
Absolutely.
His eye looks bigger than the other one, why? So what are some of the causes for that in kids?
So in kids, proptosis is a bit, it's I can't say more it's concerning in both groups, but there's a higher chance in kids that it's going to be related to a growth or tumor behind the eye. So the most common tumor that would do that is something called rhabdosarcoma or rhabdomyosarcoma, which is a cancerous tumor arising from the muscle cells essentially. And so that would probably be one of the common causes. And so if we see a child with proptosis, we often use the expression, it's rhabdosarcoma until proven otherwise.
Exactly.
But there are other tumors that can occur in children, so more benign ones. And these are commonly vascular. We call them tumors, but they're actually abnormal growths or malformations of these vessels. And so these can lead to progressive sort of proptosis or pushing forward. So in children who present with it, it's important that we investigate them to find out exactly what the cause is.
So to all the viewers back home, they should not actually wait. They must actually come to the doctor ASAP when they have this problem.
Absolutely. If they're concerned, then I think they should. The other thing is to bear in mind is when we teach our trainees is that you get causes of pseudo-proptosis. So where it might look like the eye is being pushed forward, but not necessarily so. But I think the focus here is on proptosis, and so if you're seeing progressive changes, then I think that should be an alarming sign.
Thing. Because some people sit and they go, maybe it'll give better time. But now that we've discussed this, do all patients with proptosis, as you're saying, there's growths and so forth, I mean, how do we treat it? Is it more as you would describe, conservative with medication, or do they need to go for theater? Because that's what they're thinking when they see this, like, oh my goodness, what are they going to do to me?
So I mean, if I have to answer that in reference to my experience in the patients I see.
Yes.
One of the things that actually bothers patients is that the eyes are a central sort of focus of your face, of your facial aesthetic.
Exactly.
Because when we're conversing with people, we tend to look at the eyes, and so they're very conscious of their appearance. And as you mentioned in your introduction, is that it sounds like something alien if this happens to you, and they become very conscious of it. And so I think they're wanting to know what can be done for it, and will it go back to normal. And so a lot of that depends on what the cause is. If it's a growth, which is a tumorous growth, which may be benign, then that's something we can address surgically and remove it to replace, to stop the expansion and make more space. In patients with thyroid eye disease who develop proptosis and this problem, then we have to time the surgery, but then we do something called decompression surgery, where we may remove either some of the fat or remove some of the bony lining of the orbit in order to make space to allow the eye to sit back further. And then obviously with tumorous growths, we would need to get a diagnosis, and sometimes that involves doing a biopsy or taking a tissue sample. Sometimes that involves removing the entire tumor through a surgical process. So again, it depends on the cause. And in certain patients with vascular malformations, then some of these can be treated medically with certain injections to shrink down this abnormal blood vessel growth, or even oral medication in some cases.
Exactly. So if, for example, a patient has a tumorous growth, or this growth that's sitting there, and if they decide, I don't want this surgery, what are some of the complications or the outcomes that can happen? Because not everyone wants surgery. They'd rather live with a big eye than have to go under the knife. But they're thinking, is there really a problem with not going for surgery?
Yeah, good question. And so if there is a growth there, and we would want to see, does it have characteristics of a cancerous growth? And so these would be things like rapid growth. So you would see rapid changes in your proptosis, if there's pain associated, or if there's other functional issues. So one of the things, because the space is limited, and it's what we call a neurovascular rich space. So there are a lot of nerves and structures that come through the brain that actually supply the face as well as the eye, its muscles and the eyeball. If there is a growth there and it's in a tight restricted space, then you're going to get compression of these structures. So some of the things that can develop are compression of the optic nerve itself, and that can lead to vision loss and blindness.
When you say compression, you mean pushing on the
yes,
actual
pressing
nerve.
on the actual nerve, and so that can in time lead to destruction of the nerve and blindness, which may be permanent in some patients. And then it can damage some of the nerves that supply the eyeball muscle movement, which will then end up leading to double vision because of the malalignment of the eyes. It can press on the nerves that provide sensation to the face, and so cause pain on the one half side of the face that is involved. And so it can have an impact on one's function and the function of the eye on that side.
No, I love the way you actually explained that, because then it shows that this thing can progress, and even if it's progressing slowly, the person has to be aware that there might be an adverse outcome from not having the surgery, if advised by their doctor.
Absolutely. So obviously we'll make an assessment, and if they don't have no functional impairment and the slight pushing of the eye doesn't bother them, then it's something we could watch over time. But obviously that will be guided by what we find with our examination and investigation.
So it's important that patients, I think from what you said, patients must just be aware that it's not a one-size-fits-all situation. They have to understand that if it's happened for someone, because patients love Dr. Google.
Absolutely.
And so especially with proptosis, they're like, but doc, I sure don't have thyroid. I don't know, And so it's important that they're aware of this.
Never mind patients, I also like Dr. Google.
Is it? Hamza. Okay, so on this thoughts, what are your parting thoughts on this topic of proptosis?
Okay, so I think if we just to summarize, proptosis means forward pushing of the eye, and I think this often is seen as a bigger eye on the one side, and part of the reason for that is if you're pushing the eye forward, you're separating the eyelids further,
Yes.
and so that gives the appearance of a wider, bigger eye on the one side, and that it's not a normal thing, and that if you're noticing it is happening, that you should seek medical attention for it. And that proper diagnosis is made, and that will guide management.
Exactly. No, thank you very much, Hamza.
You're welcome.
This is a riveting conversation. And thank you so much, viewers, for watching this episode today where we were discussing proptosis. So if you'd like more information about this, or you'd like to know where to reach Dr. Mustak, we will leave his details in the description box below. And don't forget to like, share, subscribe, and push the notification button so you know when we post our next episode. So until next time, take care of yourself, take care of each other, and remember, your health is in your hands. God bless.